Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing clinical aspect of Rasa Vichar and we have discussing Amla Rasa after completing the Madhur Rasa. We have seen the Lakshana and their clinical application. Now we will move towards the Karma of Amla Rasa. Just I have to mention one thing that many of you we have studied Ayurveda in the BMS and we are learning. There are very simple karma which are very easy to understand. I will not interested to discuss with them and waste your time. So we will discuss the only the special karma and their clinical application useful in the practice. So for Amlarasa, it is Ushnavirya and Snigdha Guna. So Rochan, Dipan, Pachan are very common karma. The two interesting karma from my point of view which are different is one is Pridam karma and other is Rudya karma. So let us discuss these special characters of Amlarasa. Now when Pridam karma is there, it has got two actions. Firstly, as we have seen in the last episode, Amlak Shaliti Mukamdik increases the secretions. So when there is a water content is increased, automatically Rasa Dhatu is increased and Pridam karma is achieved. This is the first way of action of Pridam karma. The second action of Pridam karma is Mana Pridam. By the natural quality of Amlarasa, when you will eat any Amlarasa like even lemon, chinsa, anything in the mouth, we always have a refreshing experience. And this refreshing experience is a refreshment of mind. So, whenever there is Pridam karma is expected along with Rasa Dhatu Pridam, Mana Pridam is more better quality or better action seen in the practice. And why it is important? It is the instant action of Amla Rasa on the mind. See, Madhuras is also a portion rasa, it will portion Anna and Sharir and Mana as well as, but it will take little time. But Amla Rasa, as soon as you keep it in the mouth, on the tongue, it will give you the refreshing experience at mind level instantly. And hence, you can use this Amla Rasa in Manavasa or depression or what you feel the patient says in their language in today's practice, we are feeling very low. So, make them refresh. Amla Rasa, Pridam karma is very very important and useful in the practice. The second important function is Rudya. Again, you can have this at the two level. At Rudya as a Avayav and Rudya as a Sthan of Mana. Rudya and Manas is Sthanam. So, as Amlarasa is refreshing to the mind, Rudya karma is achieved by this action on mind. This is the first line of action. Second line of action is like in the Rudya karma is by in the symptoms like palpitation. For example, when there is Pandu, there is a Rattakshay and there is a palpitation, Ruspanda Lakshan. In that case, Amla Rasa is Rattavardha. Immediately by Ushnavirya, it will increase the Rattadhatmagni and then Pandu is corrected. This is the first line of action. Second line of action is when there is Rattapitta and Pandu. There is loss of blood and because of that loss of blood, there is Rattakshay. In that case, Amla Rasa is useful only when you are using the dravya which have Amla Rasa but Virya is Shita. For example, Dadima, Amalki. So, when there is Rattapitta and Rattakshay and palpitation is the symptom, you have to use the Amla Rasa carefully and you have to avoid the Ushnavirya dravya which are having Amla Rasa and you can use Amla Rasa like Dadima, Amalki, Nimbuka which is of Shita Virya. So, they will stop the bleeding, Rattakshay, further Rattakshay will be stopped and then as Ratta gets increased by the edema etc., the palpitation like symptoms are taken care of. Ushnavirya and Snigdha Guna is a good combination, it's a rare combination, and hence it is a very useful drug in Udarashula when there is Vata Prakop. So it is useful in the Udarashul when there is Vata Prakop. It is useful many times there is Adnan Anah because of Malavrod and there is a pain and patient feels the pain all over the abdomen. So as it is, if the Malavrod is of because of the mainly of the dryness of the intestines, this Amlarsa is a Kledana, Ushnavira Hemasparasha Kledanologu. So because of the Kledan action, it increases the water content of the intestine, makes them it's moist, and that because of this moist water content, Malavrod is relieved and automatically Vatanoloman or Adman symptoms are also taken care of. For Udarashula, when it is because of Ama Nirmiti, Ushnavirya is a excellent pachan and it relieves the abdominal pain in that uh, in that way also. So main the function of Prinana, Rudya and mainly on the GI tract, Andosotas like Dipan Pachan and Udara Shulagna. As I said, it in the Rudya, it is Vata Shamak. So when there is Shul because of Vata Vyadhi, Vata Dosh, it is useful in Rutshul to make the Vat to flow in the Anulam direction. These are the main functions of Amlarasa which are very important in the practice and which are very useful to the patient. In Atiyog, again it is all because of Ushnavirya and the Shaithilyam, Timira, Brahma, Vispota, Jvara, etc. And if it is used in Ushnavirya, is used in Ratta Pitta, it will create Pandu also. So, Amla Rasa, as it is because of Dipan Pachan and Rochan, we add lemon in our regular meals or we use chinsa, tamarind in the as a content of the what you can say dal etc. So it will take care of Rochan, Dipan Pachan and also Vatanuloman when you are eating the meals. So this is the Amlarasa. Prinana karma, Rudya karma are very unique characters or karma of this rasa because its action, instant action on the mind. Other functions are very easy, kapha shaman, etc. You already knowing that, so I will not waste your time in these routine functions. In my way, these the special functions we will discuss in this series, and these are the special functions of Amlarasa. Please subscribe, tell your friends, give your suggestions, and we will meet in the next episode with love and trust. Thank you very much.